with Procter & Gamble, they have asked me to help find a new place to donate what they've spent a lot of money developing, a new iron chelator that works by mouth. And that doesn't mean a lot to anybody in this room because you're really not into this issue that deeply yet. But in 1975, there was a conference on the development of oral iron chelators because Cooley's anemia, for example, that you hadn't thought about. Well, now we have every poor slob in the country being told on national television, take supplements, and what's in every supplement? Iron. And who needs it? I mean, every study shows that the higher the ferritin, the sooner you die. So, I mean, then if you get into this story and begin to see the ramifications, I'll just titillate your imagination a little bit. The studies that got me interested enough in helping now to find a university that we can donate it to so they can get a tax write-off because they got a lot of bucks invested, but it's not in their interest to pursue the development of an iron chelator for oral use. But among its usefulness, in an animal model of head injury, given many hours after the injury, 95% protection against any loss of brain cells. Because of, so if you start to think about this, and if you take a mouse model, we see a 20% increase in lifespan. So of course, my life's work is in chelation, and I knew that EDTA made multicellular organisms called rotifers live 50% longer. EGTA made them live 75% longer, but I couldn't clinically. So I take oral EDTA every day since 1983, and we'll get into that. But anyway, if we then look at the next issue, if we think about where did the problem come from, that's another issue. Because let's go back for 1 second and say, when President Eisenhower was President of the United States, he had about 7 heart attacks. And his cardiologist was Paul Dudley White, who was the instructor at that time for Kilmer McCulley at Harvard Medical School. And he preached that if you were a very good doctor, you'd diagnose at least 3 cases of coronary artery disease in your lifetime. Now, that's just 60 years ago, folks, so something's really happened in 60 years. Now, it could be all the fillings. Some of us might blame the processing of oils. Others of us might blame the increasing amount of junk in our bodies. But somebody's got to come up with a theory here. Because, folks, everybody had arteriosclerosis at the Egyptian mummies. And we take the Iceman at 5,000 years ago. So you can't blame the television sets. You can't blame the lack of a busy life because arteriosclerosis has been with us for 5,000 years, minimum. Now then, why do we drop dead? Maybe we have 2 different diseases. Maybe dropping dead is the hypercoagulability and this blood clotting and this infection, this inflammation stuff. So anyhow, there'll be more to try to put this together here. Okay, here it is. Thank you. And so, in any event, Lester Morrison became a mentor of mine because this gentleman published in 1941 in Journal of the AMA that cholesterol was a part of the story that we've all been interested in. But he then immediately went on to the issue of coagulation studies. And he was the one that first jumped into heparin and then found it wasn't the greatest, and chondroitin sulfate and found that was kind of expensive and not really like the mic we might fiddle with from shark cartilage and bovine cartilage. Anyway, this guy wound up being the guy that put the pieces together for me. He had a simple thing, it's called a Chandler loop, and with the Chandler loop we find out when the blood is going through a tube and it's got a sharp angle in it, how long does it take for a clot to form? And we use that as the method of proving that when I added my expertise to his $10 million of the research, which he got from the American Heart Association and others, and his simple book really describes a program that kept about a 91% reduction in deaths from heart attacks in patients who'd already had one. So he was dealing with natural approach to hypercoagulability. But it was all based on this heparin-like sulfated polysaccharide that had happened that the EDTA really worked. So my background in chelation, which I had formed I wrote the protocol, 1 million plus patients have been treated by the protocol that I wrote, and we haven't killed anybody following the protocol. So EDTA has been very useful. But it's also got a problem, and that is, what is the scientific basis? What are we doing when we chelate somebody? This is not simple, folks. Just to give you a little bit of background, metal binding in medicine is what I found in the library when I went to the library 35 years ago to get into this field, and it was Marvin Seven. This had the leading scientists of the country sitting around. Every word is printed here. And you can really learn how, in 10 years, the concept of chelation had jumped from the clinical lab into actual clinical medicine and what it was doing which is not what we think it's doing always. It's always much more complicated. It's another word, however, for bioinorganic chemistry, which is another word for chelation chemistry. And whenever you get into this field of figuring out what's going on, if you start out with a premise and you confirm that, that doesn't mean that you're anywhere home. For example, when I had to write the protocol in order to keep chelation alive, I took the laboratory had in their package insert at that time, and they were dumping the product because there was only 2 years remaining on their patent, and the thalidomide tragedy had changed the laws so they couldn't continue to tell people it was possibly effective in vascular occlusive disease, which means I'm increasing blood flow. Never did that language say that I'm reversing atherosclerosis. Now, I've helped 1 million people avoid the bypass surgery. I feel good about it, but I don't feel good because most of those people still think, oh, it's a chemical rotor-rooter and it's cleaned my arteries. Nothing could be further from the truth. I can autopsy people and still have 90% blockages after they've had chelation. But the difference is, for complex reasons, which I wrote in my book, that the patient says, hey, my pain was away, I can run. And so that was getting into endothelial relaxing factor and things that are far more complex than we're going to get into at this discussion today. But in any event, the book is still around and it's still kind of a classic. At the time I wrote it, I didn't even plug in. This is already 15 years old. I didn't even plug in the free radical theory, which you'll see in a moment that was gross oversight. I was really focusing on the anti-aging aspect because all aging mammalian cells accumulate more calcium. Your aorta turns to stone. Anyhow, you'll get that. There's so many references today. This said 820 references. Since then, we've picked up about a total of 6,000 that are now in 60 boxes that have been turned over to the president-elect of ACAM. I am the only person who probably has seen most of that. But I haven't got it all up here because I was not crazy enough to trust a scientist that said he would return them, and that was 10 years ago. And so they have actually come back our direction just in the last couple of months. Toxic metal syndrome is a book, somebody has it out there, and it's going to tie this story again to what is it that we're dealing with when you get into chelation. There is never a single metal that is your enemy. You can focus all you want to on mercury, but let's just say you were reading the conferences on iron overload. Whoever's got iron is loaded with lead. So we have to become kind of knowledgeable about what are we going to do about the issue. Now, with oral EDTA, the AMA Archives of Industrial Things points out that you get almost the same amount of excretion with oral EDTA as you do with IV. And I'm going to dwell on that a lot. It's on my website. But it's kind of interesting to know that low levels of EDTA replace other antioxidants in foods to prevent the development of rancidity. That's why they sell it by the railroad tank car in this country, and everybody gets between 15 and 50 milligrams in your diet of EDTA every day. My suggestion is that that's too little, but you'll get that idea deeper as we get into this. This review examines the safety of prolonged quantities coming in and to your body every day, because it does tie up transition metals, the same as I said you don't turn black and blue after your sports injury. So now I'm playing around with 2 iron chelators. I mentioned one coming out of Wobensheim, a widely sold natural product, using a newly recognized rutin like quercetin that is a very tight iron binder that is a big molecule that presents. But with the oral chelation, I wrote in the Journal of Holistic Medicine some years ago. Dr. Cranton was the editor of this journal, and he invited me, because at that time he owned a company selling oral EDTA products. He invited me to put in an article. He's since sold that company, and the last journal that came out from the academy that I founded suggests that you will drop dead if you take oral chelation, probably instantly, because you'll be so deprived of things like zinc and manganese, which I was disappointed that he would change his opinion without any references, and I'll obviously be submitting a rebuttal, and maybe it'll get the thing out so there's some discussion and people will learn what the truth is, which is obviously more complex. But in any event, since I'm so interested in all these LPAs and fibrinogen and magnesium depletion, there's a lot of things that I do when I want to keep my patients alive with oral products. Now, the IV versus oral, I will never state that one replaces the other. They do things quite differently. Only an IV treatment will clearly lower your ionizable calcium by 50% and thereby triple your parathyroid hormone. Now, if you don't happen to like Fosamax and you don't understand all these things, we do know that parathyroid hormone activates osteoblasts, and we do know that most of the doctors who have taken lots of IV chelation provably have better bone densitometry by far than anybody else in their age and sex category. So we do know that we're doing something interesting, and I've been at the autopsy table on some of my patients who'd had over 100 chelations, and the surgeon saying, gee, I don't need the sharp shears to cut through the aorta to take the heart out, because usually the aorta, clearly explained in this book, turns to bone on you as you turn older. Finally, it may be actually what's holding people erect because their bones are becoming mature. So in any event, there are osteoblasts, actual osteoblasts, and it sounded like a stretch. It turned out the first doctor, endocrinologist, that taught me all this stuff, Dr. Carlos Lamar, his first patient came in and was adjudged crazy because she said, every time I slump in the chair, I feel like I'm being stabbed. And he actually took the x-ray, and she did have a bamboo aorta, and chelation reversed that. So it was a stretch, but it was just to get your attention about the fact that there's a complex things that I'm looking at. I'm now in anti-aging medicine. In anti-aging medicine, I want to deal with the calcium aspect of atherosclerosis, which has nothing to do with the death aspect, which is the clot and the infection. So now, if I just want to keep people alive, I tell them, hey, that's my specialty. You have the article in front of you. I tell people orally we can do that. I'm not very concerned about letting any of my friends be operated on. Do they want to buy an IV treatment? Yes, if they would like to be younger physiologically and have documentable improved blood flow much faster than any other method currently available. But Altian Corporation has ALT 711, and it will be out in a couple of years, and it is a chelator developed by Dr. Serrani at Rockefeller University, and it actually prevents the cross-linkages of tissue as you grow older, particularly beneficial to replace aminoguanidine, which those of us in the field understand also prevents the cross-linkages of vascular tissue, as we see in diabetics. Anyhow, this was a problem for oral EDTA. Gave it a black name. A group of doctors on the payroll of lead industry said, okay, we can't afford to tell the boss to clean up the plant and ventilate back where the men are working. Let's just give these poor slobs enough lead EDTA tablets to keep the blood lead down so we can keep them on the job. And that became unethical medicine. But it tainted the concept of oral EDTA as being a cheating kind of medicine because they didn't clean up the place. And it is complex. But I'm going to breeze through these very fast. Oral EDTA is useful as a detoxicases in cases that are not severe. In fact, the PDR statement you'll see on my website says that oral EDTA is a great treatment for asymptomatic increased body burdens of lead. Well, obviously, that's just another piece of information you float into the head, because then we have to say, what are we going to do about the aluminum? What are we going to do about the mercury? What are we going to do about the cadmium? It's the research last year, American Journal of Cardiology, in dilated myocardiopathy, 20,000 times more antimony and extremely high levels of cadmium, mercury, lead were found in the heart of people with dilated myocardiopathies. So these metals are a fascinating thing. When you get into all the studies, cancer always has twice as much of the metals and more of the it's really a lot of stuff to learn about. And this is just to let you know that places like Bayer at Harvard did a review article and said that the IV is more effective than oral in the acute stage, but the oral is important to short. So I try to say, hey, it's not one or the other, everybody. You probably need both. You probably need, in a simple statement, Claire Patterson, head of California Institute of Technology, showed that the average person today has 1,000 times more lead in your bones than you did before the industrial age, and he proved all this by drilling in the Arctic and the Antarctic. And he had to have you in a spacesuit because you are so filthy with your lead that it's more expensive to have a lead-free environment than a germ-free, because one fleck of the dead skin that comes off of us wherever we walk is enough to wreck the experiments. That's the way he presented it, and I had him speak. As I said, he's chairman at California Institute of Technology. In any event, so we know that there's not a lot of absorption of EDTA. Some studies are 2.6 to 4.2. That's not very exciting, but some are up to 18%. Well, who's going to absorb more? Probably the patient with leaky bowel. Probably needs the higher absorption. Just a thought. Anyhow, but the concept here is very complex when you get into it, because if you take the EDTA with a multiple tablet, then what the EDTA is next to, it's next to a lot of zinc and other useful, and it loves zinc. And so the absorbed EDTA is going to go into your body delivering zinc, but once it gets in the body, it says, gee, the zinc is now picked up by the albumin, and we have all these chelating metal-binding substances in your body, ceruloplasmin, transferrin, metallothioneins. The reason low albumin people die and high albumin people live a long time is albumin is your cheapest chelator. So if you look at this whole issue of metal toxicity quite differently than most of us now look at it, you're going to understand that it may not be possible to have my body have 0 levels of lead, because I'm an expert at having done, we had 50 chairs, we've treated thousands and thousands of patients, and when you've got lead poisoning, you see this huge increase, which by the way comes up on the 2nd and 3rd visit. So that if you're looking for a good way to measure it, provocative testing is fantastic. And you can cheat. You could use defroxamine, and you could use oral chelation, penicillamine, you could use the garlic, you could use a lot of the tricks, all at the same time, because you want to see every kind of metal that comes out. And by the way, if no copper comes out, what's the diagnosis? Copper deficiency, right? So there's tons of information in doing 24, yeah.
Wouldn't it be an appropriate experiment to do to see how you can increase the absorption of oral EDTA?
You might as well wait till the end of the lecture, because everything you want to know, if you let me, it's all covered. Liposome-treated EDTA is being studied at Baylor University, 60% absorption. Okay, so did you hear what I said? Liposome-treated EDTA is coming. Okay, so are rectal suppositories. They're already being out, they're patented. So the thing is, let's just try to face it. I mean, EDTA happens to be a molecule that we've studied a lot because it's cheap. We have a lot of experience with it. We know the safety index. As I just told you, I'm being donated something that they may have millions of dollars in, and I think is a potential billion-dollar market, because it didn't mention that it even stops the aging changes in skin and prevents the ultraviolet damage to skin, not working through the normal sun blocking mechanism, and that the tumors in skin virtually don't appear until almost the last week in life on animal models. So anyway, chelating is fun. It's my life's work, and there's going to be lots of ways of delivering it to you. I'm just trying to titillate your imagination, because I have worked with oral chelators like malic acid. Malic acid is a better chelator than desferoxamine, and it's cheap. So I put that in with garlic and D-L-methionine. But why did I leave out cysteine? Because the studies were clear. Lots of cysteine really does move the mercury wonderfully right to the brain. So we probably don't use some of the earlier formulas that were out by some of the companies that thought they'd figured this out. And once you have it moving, I want it to move on out of the body. So therefore, I will be strongly advocating the concept of having things in the intestine that have a tremendous affinity, because the intestine is rapidly served by a very vascular situation. So if I have a good chelator in the intestine, and I think Proalgin and Dr. Klinghardt is indicating we can get good results with chlorella, there's lots of things. I happen to put in a product that I designed. I put in beta-sitosterol, which in Germany is the equivalent of Questran, a bile acid sequestrant. So once your mercury is moving out of your body, it's going into the liver. I now don't want it to go down 2 feet and have enterohepatic reuptake. So I have a very convenient system there. But in any event, the results of oral EDTA, Dr. Morrison is the one that really, he was an invited speaker for me at ACAM. And here he was talking about his 91% less heart attacks from an oral formula. I thought, hey, that's pretty important. And then I started working with him and found that it was published in Nature that if you took the polysaccharide in the presence of EDTA, it worked like heparin injection. So that was kind of fun. And so the other story that nobody really understands very well, and we didn't cover it well enough because probably my fault, I wrote the book Chelation Answer, and I really slanted it heavily toward this concept of pathologic calcium accumulation. And I have not worked out all the reasons. Some of my slides may give you an idea, but there's a very important slide here. Dr. Bloomer is unable to be put down. His research is impeccable, 18-year studies. Now actually going on much more than 18. Anyhow, it was 91% less deaths from cardiovascular disease and 86% less deaths from a little thing called cancer. And all he did is pop you in the vein with a push instead of sitting there for 3 and 4 hours the way I adopted in this country when I wrote the protocol. He used the calcium editate, which is not going to perturb the lowering of ionizable calcium, which is why I thought it was worthwhile to stay with the extra benefit. But I have to give a lot of credit to somebody who proved that EDTA does a lot of things, and we're still in the process of learning everything it does. But if you were an expert, you would have to accept one thing. It's the treatment of choice for lead. And that kind of suggests then that the rotifers experiment where we had these little multicellular organisms and we dipped them every day and they'd live 50% longer. And then we got to the testing on sea urchin sperm cells, and they live 10 generations longer than ever seen before. And all the experts could say is maybe we are all living in such a sea of toxicity that our enzyme systems are always getting loused up, because when you're looking for a zinc, it's still occasionally sliding in a lead, and you're operating suboptimally. No one has another great theory. There's still a lot of research to be done on EDTA, in other words. Anyhow, Fuster will be busy coming up with new drugs that will help the Vioxx and the other ones, and that will be fine, because that will be, but my suggestion is that for patients, particularly those who are not doing well on standard therapies, I still will use chelation, but I have to deal with this inflammation. Now, I told you about the Wobenzyme, and I explained to you that Wobenzyme made antibiotics work significantly better. Meaning, if you did diagnose chlamydia, which one of our leading alternative doctors fell to the floor not too long ago, and he thought he was going to die. Marked arrhythmias, all the whole hypertension, not a very nice picture. The astute doctor happened to be an expert at this and actually did measure the chlamydia antibody titer, and he was off the scale, and he gave him the antibiotic. And the net result is the doctor's doing very well again. And it's just very important to understand that this is an important thing, but had it been cytomegalic, you would have had to use an oxidative therapy. Now, IOMA, which I'm on the board of, will be meeting in Denver in about a month, and that's where we do oxidatives. And Garth made a good point. He said, let's face it, it's a little dangerous to use peroxide. By danger, the danger is you'll lose your license. The thing is that you have to understand, they did take Dr. Dorman's license in Kansas and started using Jonathan Emord as the attorney. And the FDA really hates this crazy peroxide. So what's the, I've always have to teach people practical cheating ways that get the same result, and that would be high dose vitamin C. Because when you're doing high dose vitamin C, you are an oxidizer. It gives up one electron, it's dehydroascorbate. In the process of its metabolism, it goes right through trying to get to CO2 and water, you're going to have hydrogen peroxide intracellularly. And the results of that were presented last week, where I was speaking in Orlando with Dr. Darrell C., who's at Huntington Beach Hospital, 10,000 square feet. Started there about the 27th of November, less than 4 months. He's having to now get another 10,000 feet. He's dripping people with 75 to 150 grams of beet-derived vitamin C and adding the minerals to it, and putting some things that you're not familiar with, like endographine paniculata and agaricus and some other stuff we won't get into today. But I'm just letting you know that those of us working in the field of cancer with natural products are finding a lot of fun here. And so it is clear that anyone can have an activation of their herpes simplex at any time. And therefore, you'd have to realize that people are a walking time bomb. And so if it's my accountant, I'd never explain my records to the IRS, I keep him alive. So I tell my accountant, please take the oral products morning and night, so I have them on both sides of this equation. But the immune enhancing story is a fun story. Now, a lady in the audience was mentioning the transfer factor, and I really like transfer factor. I was so excited about the results we had, and we were buying from Animune Laboratories, and the doctors, we couldn't keep it in stock. And they had some of the more specific, like for EBV and herpes, et cetera, and then they were hit by the FDA. And I got the last shipment out of them, and they were closed. And so I finally wound up, and I put together a product that's described in the handout that we will be giving at the back of the room. You'll all be getting a little thing, a little red sheet, and it's just inside of there. There's my protocol for heavy metals, my protocol for cardiovascular, and I do mention in there a very simple thing, a little explanation of Garlic Plus, so you understand what I built when I said chelation. Because garlic is the poor man's chelator. It's definitely going to take care of mercury. In fact, when I consulted for the Kyolic company in Japan, I have slides that would just astound you. We give the rats enough red food dye that they all turn red and get cancer. We give the same amount with the garlic and none of them turn red. None of you had any idea that it's doing all this. We then do the same thing with lead and poison them all till they die, and they don't die. We then poison the plants with the lead or the cadmium. So it's nice for you to know that it's real. It's not a figment of somebody's imagination. I didn't have all those slides in here. But the other article about this immune enhancing story, which starts with the aloe vera. The Manatech people are multi-level. We don't all love multi-level, but we have to respect things that work. Carrington Laboratories had a heck of a product. I've been lucky enough to find something, and I added it to a few other things, including a colostrum-based thing, and I call it immunity, and I'm very happy to state that we have enough tricks in there between astragalus and arabinogalactan, and supernatant, which simply means that when you take away the bifido after you're growing your bifidobacteria to sell them, the liquid that they were in, they have their own way of protecting themselves from their enemies. The Ayurvedic doctors call it neem. But in any event, that's a stronger antibiotic than the ones that you use. So when you're looking for alternatives, we've tried to make it available. And that sheet that you'll get in the back will tell you a little bit about how to do some of those things. The new paradigm then in cardiology is clearly going to be molecular-based cardiology, and it's really nice to have the immediate past president say, hey, let's treat the bloodstream, folks, and give up on that surgery. The thing is that I take full respect, however, that I did form ACAM, and we now have Dr. John Barron of Cleveland, who's my father's colleague, and he's 89 years of age, and he's still at every conference, and his hair is the same color as mine, and his skin is the same color as mine, and he's had about 3,000 IVs. Dr. Bakay has had about 2,500 IVs, and he was with me in Istanbul. He's at every meeting, and he's down in Little Rock, so that there are some people who push the limit to prove what my hypothesis is, and that is that all of us have a deficiency of chelators, which are metal binders to deal with a 1,000-fold increase that your body never dreamed, and now we have all these poor saps getting the iron every day on top of the lead that's in our bodies, on top of the mercury that you can't get. If you eat fish, you need the fish, or you can't have slippery arteries. You've got to have something to get a pentanoic acid, and you're getting the mercury. So since I don't have to have a guilt complex, I take oral chelation every day anyhow. But it's just fun for you to know that there's something very powerful in the anti-aging field going on. Now, immortality is really not the subject that you think about, but on January 1st, New Year's Day, CNN covered the breakthroughs from stem cell to gene research, and they showed that they're now able to make you your own ear. So I think that it won't be that long, and they're talking about finger and heart cells and liver and kidney. So I think we'll have a lot easier time getting people to give up their teeth when we have an actual tooth of their own, from their own body, that we'll be putting in. I wouldn't give us but 5 years, and I think those things will be happening. So I think it will be a lot easier when people have what they consider better or more cosmetically acceptable choices. But in any event, when you get into this immortality, one thing is that because I did form the International College for Advanced Longevity Medicine 2 years ago, because I have to come up with a model that allows the doctors that want to be on the cutting edge to not have to always be violating Medicare rules, be guilty of fraud, facing jail, losing their licenses. And so clearly, if I move into a plastic surgery, everybody knows they're going to pay cash for my services. So I decided to be a plastic surgeon of the inside of the body. And so the thing is, in doing that, this plastic surgeon, who's really one of my really good friends, Dr. Arthur K. Balin, is an MD, PhD, and he's a direct immediate past president of the American Aging Association, which is where all the guys that research aging at the National Institute of Aging hang out. And they'll be meeting June 1 at Tufts, and I'll be there for the meeting. But the thing is, what we really had to do is he put the book together, because the government hasn't done it for it yet. And that book is, how do you know if I'm 65 years of age in my heart, 85 in my head, 25 in my fingernails? How do you know? What would be a reasonable way to come up with that? Well, we know that Michael Fossel, who's really a sweet guy, and his book, Reversing Human Aging, was so right on that he's been on 2020 and everything with all this research that's going on. In the telomerase theory, if it doesn't win on the aging, it will win in the cancer area, because there's going to be some practical payoffs of this stuff. But I've mentioned that when we age, we have this nasty tendency to go from having a little bit, like 10 micromoles per gram of dry weight of calcium, to 1,400 at age 80. That's clearly a 140-fold increase. So obviously, if we can all figure out, now we do know that IABDM did provably take pathologic calcium off your arteries. You could have a calcified arm. We could have calcified kidneys, nephrocalcinosis, and provably I can get rid of that. But I have to do a lot of it. It's kind of slow, but it's kind of important. We have to learn from these things of why are we calcifying and what's going on. Now, when I published the first article on this, on calcification of blood vessels, I thrown in the little fact that you've got to understand the American diet, by the huge study done by the Department of Agriculture, Human Nutrition shows that you're getting 1,400 milligrams of phosphorus to 800 calcium in every human being. That's the average in the United States because of the phosphorus industry. They're pretty powerful. That's the soft drinks as well as the NPK on the soil. So these are not simple issues to deal with. Because as an expert in this field, I have to tell you, any animal given that ratio of more calcium to phosphorus will have secondary hyperparathyroidism. That's the animal desperately trying to wring more calcium out of the diet, which then makes what happen? You lose the calcium in your bones and you calcify your soft tissues and you get irritable on the way. Anyway, magnesium deficiency is part of that. You think vitamin D is simple, folks? I mean, we got everybody now told don't go in the sun or have SPF 40 on or whatever. You know, if you take the average person on 400 units of D, you'd think there couldn't be a D deficiency. That's what you believe. You couldn't be more wrong. 43% of people are still deficient. So this nutrition thing is not simple, and it does lead into a need for us to learn a lot. And we have to protect the public from the idiots that would like to say that rubbing horse dung is all they have to do on your head, and you won't be bald, and you'll be a strong man, and you'll live forever anyhow. We had to set up some guidelines to protect the public and encourage this. So we do now have a board. And any PhD, dentist, etc., are eligible to become board certified in the field of advanced longevity medicine. And some of that training is offered at the anti-aging courses put on at ACAM, a group that I formed years ago. And because they didn't stay completely into anti-aging when I wanted to, I formed the International College for Advanced Longevity for those people that really want to make this their life work. Now, this foundation is run by a good friend of mine for 30 years, Saul Kent, and they do have some useful things. Their website, lef.org, for life extension is a useful thing, and their guidelines that they sell you are extremely worthwhile. For example, they have put together a protocol. It's only about $25, and it'll cover everything from hepatitis C to stuff that you could never keep up on because they keep up on the international thing, and they go to all the anti-aging conferences. Now, way back, when I wrote that slide, I thought NIH was really going to do it. It turned out that it's so political because everybody wants to have their test be the test for anti-aging. And so that what I'm telling people now is that a simple battery of tests called the H-Scan, sold by Dr. Hoch, H-O-C-H from San Diego, is an interesting compilation that is accepted, although it's not officially accepted by them and doesn't have to be. It simply says, how many candles can you put out? The pulmonary function, and near and far vision, and hearing, and reflexes, and memory recall. If I give you 10 names, how fast can you do them? And then you can add to that things like creatinine clearance, et cetera. I just want to get the thought in your mind that some of what we are going to work on with you will be to find strategies that will take very wealthy people that don't want to lose their vitality, because if you get the picture with what these anti-aging guys are telling you, they're saying within 10 years probably you won't have to age another single day beyond that. Reversal is obviously harder. But if you understood that sentence, you take awfully good care of yourself for the next 10 days, and you get the next 10 years, and you get kind of fussy about the water, the food, the light, the air, the attitude, the information, the knowledge, and everything, because it's not a simple thing. Now, you've been seeing some negative thing about the gene stuff that's been going on because they've had some deaths and other stuff, but don't lose heart because they're using a virus to put it in. Nanotechnology is going to make it quite easy, and there's going to be a lot of stuff happening. Those of us in this field who aren't as skilled as Dr. Klinghardt with his fantastic muscle testing are still interested in EAV, and I have seen so much about the Vohl's work in Germany that there isn't much doubt that that's a useful adjunct to help you individualize so that you can. The biggest thing I used my Vohl for, I had 3 testers in my clinic. I had patients bring in everything they're taking. That's the first time you find out what eye drop they were taking for the first time. And that eye drop was totally contraindicated with the drug they're on. But nobody ever gets all the information. Or what crazy thing they bought in the health food store that needs to go in the wastebasket immediately. Because of lack of quality control, folks, when you think, if somebody tells you that they've been taking from GNC, Primrose, for 2.5 years it was nothing but rancid oil. So I'm trying to let you understand that you need some method to be, but that's the kind of medicine that really is only going to fit for people that are really into this whole concept of advanced longevity and know that this is not sickness. In fact, my ideal office would be across the street from the Mayo Clinic. And the minute you say something hurts, I say, go over there because they've got sickness insurance. Here, I'm a specialist at using all the data that you can acquire, and every test has value for me, but I cannot operate in their system because it is really complex when you get into you don't have to accept Medicare to be under Medicare. If you order a test on a patient, you have to be up to the standard of why the test, so that's why I prefer to be in what we call the research model here. The molecular markers of cancer are a subject that I really have a lot of information on. Those of us at oxidative medicine have found on really deep-seated infection, if we combine the ozone and the ultraviolet blood irradiation, which I'm very excited today about the laser presentation made earlier by Dr. Thomason, because you're almost playing in the same pew here, because I go to all the meetings on the physics of health, where we've proven now that microelectric current, absolutely. I can just tell you a quick side thing, because I'm so excited about that laser research, because when I was at the International Congress of Doctors from Acupuncture and Chinese Medicine, the head guy from Finland had been appointed to find out was laser to be approved in his country. And he showed me the same kind of lesions that you saw today with a fairly non-expensive laser, and combining it with microelectric that he put home. Now, the microelectric in our country, alpha stem sells for about $500 to doctors, and it's covered by Medicare. Anybody with anxiety, depression, or pain isn't eligible for prescription. So now you have something that didn't mean anything to any of you, but I'll wake you up so that you don't go to sleep. I have a person who was applying for a job, decided to die in my office. Not a good thing to do. She was the head nurse for the large group of cardiologists in town, and she didn't like what they were doing. She wanted to join me, and it was not an ideal time for her to die in my office. And so she had a massive brainstem stroke, and she was obtunded. Now, I had just gotten off, for about 7 years now, I've done nothing but go to meetings and every subject in the world, and every weekend I'm some meeting somewhere. And I had just been with Stephen Aust and Blaine White, and they had advances in free radical pathology. And it was clear that you could have a dog stop the heart for 10 minutes, and if you have an iron chelator, number one, and a calcium channel blocker, you start the heart, and brain's normal, the dog's fine, everything's great. So I knew that from that, and if you don't do that, of course, the dog virtually doesn't revive, or it's a vegetable. So this lady, we instituted some pretty heroic things. I started the verapamil IV for calcium channel blocker and put her on EDTA, which is as good as desferoxamine for iron chelator. And then she's still moribund, but I was protecting the brain from the issue that we're going to have to deal with. So then I put on, from ear to ear, transcerebral electricity. As soon as I turned it on, she's alive and talking to me. As soon as I turned it off, she's dead again. So it's very clear that all the stuff that you read about the body electric and Becker and the need for cell signaling, that's another whole dimension to our medicine. And that's where we're going to have to go into, is to more dimensions to understand how to use accurately the magnetic devices that are like at this show. I mean, that's widely used in the whole world, the magnet. So if I combine, if I see the dramatic studies that he showed on just the laser, and he's being a scientist, if I'm allowed to cheat, I obviously would have put the patient on the Wobenzyme. I obviously would have given the patient, in addition to the laser, the microelectric, which I've learned from the chief of all of Finland's studies, that just shortened the time in half, and then I'd put the patient on a magnetic pad so that you had total ability to get rid of all aggregation. Because if you get into a lot of this, there's a coagulationopathy. In other words, what you've got, if you understand why I said that you don't have to go blind with glaucoma and macular degeneration, you'd have to go to all the meetings on vision that I go to, but the capillaries are clearly plugged off by cells that have too many adhesion molecules in the capillaries not getting anything through. So if you can digest that with Wobenzyme, in that way, if you're covering the whole spectrum from the biochemical into the physiological. And all those things clearly increase the oxygen. And of course, I had 2 hyperbaric chambers. Now I'll tell you another dramatic story to get you interested in stacking therapies. Take a patient who comes to me with Parkinson for 8 years, and they can just barely make it down. So if you think it through, I'm going to spend a lot of this guy's money, but he wants to see a benefit. Now, if I start out in the morning and I first do a colonic, then it means that whatever else I do is going to be easier because there's not all the toxin that the body and the liver is having to deal with. That's fairly obvious. Then, because malabsorption is epidemic, and no matter what pills I give them, and I think I design awfully good pills, it still doesn't mean that very much is getting in. So I then do the IV drip of a lot of nutrients. Now I'm starting to get a picture that might work, and now I put him in a hyperbaric chamber, which, by the way, I can take a foot that's ready to be amputated black, and it comes out pink. And you can I've taken people a week, 10 days after stroke, and have them actually the same day able to sit up and write and walk and talk when they came in by stretcher. So I mean, this is all fun. But you're doing that, and now if you add to that, now you got them out of the chamber. Now all of a sudden, doing the little microelectric currents is really fun, because now you have a body that's ready for the signaling and has got some ammunition there to make the signal allow the events to happen or supposed to happen. Oxygen is a fun stuff. It was really interesting. The Oxygen Society are mainly MD PhDs, and all they happen to talk about at their meetings were chelating agents and hydrogen peroxide. But were they nervous to find out that I do that to humans? Because they only do it to lab animals, and they couldn't believe that anybody was actually treating humans with this advanced medicine. Anyhow, oxidative medicine is very exciting. Hyperthermia is oxidative medicine, and so is electrical medicine. And Dr. Dawes is getting such results on far advanced cancer. We have 3 hours of film showing brain cancer, lung cancer, liver cancer, gone, using combinations of oxidative, so that it's a big field. The hot therapy that you heard about, that he said works sometimes, doesn't work. Obviously, nothing's going to work in everybody. Our job is to figure out what stacks on top of what and to set the stage so that I've tied up the heavy metals, gotten them moving, got them off the foods they're allergic to. I'm sure you all have the general thing. This is just an inexpensive way. I liked it because Julian Kenyon belongs to one of the societies I belong to, and he designed something that lets the patient, for I think $350, they can find their own acupoint. He has the guide, tells you if it's migraine headaches or whatever the problem is, how to find the point and treat it, and if it doesn't help them, they give the money back, because they're pretty confident that it does help. But you can see that that's just using a microelectric current then to help cell signaling on a meridian. And if you treat that meridian with a laser, with magnets, with microelectric current, you're really getting the whole body into a chance of it being able to communicate and do the healing. They teach a lot of this at Baden-Baden. My friend Hans Nieper used to really push me. I see that in Baden-Baden you'll have 4 floors of biological therapies that you've never seen, that go from the lasers to the electrical acupuncture, all kinds of stuff. They're into resonance therapies and things that we don't have time to talk about. But it's exciting, but we are way ahead on the nutrition. So if you get to combine what they have and what we have. But nutrition isn't going to work if you don't realize that so many people, 7% of people alone are gluten sensitive, and they have therefore provable subtropical sprue type disease, malabsorption. And if we don't find what people are eating that they're allergic to, you're not going to get the results. This thing that syndrome X and the hyperinsulinemia, it is a growing epidemic. We have to pay attention to it. It's interesting to note that by age 50, we really do all have cancer, technically. It's only 50% of it is men in the prostate. 38% are test positive, a dead body at age 50. If you go through the breast carefully, 38%. And if you go to the thyroid, virtually 100% of all people show what, under the microscope, is called cancer. So that means that, what is cancer then? If it's that prevalent, they say, hey, wait a minute, what are we going to do with this? Are we going to start treating all those people? Heck no, because it's clear that the sooner you go to the doctor, the faster you die with cancer therapy. So it's not a good place to be. So that the AMAS test, I had a lot of experience with, and most people don't understand it. The anti-malignant antibody happens to detect most cancers, but it's about 5 years before the lump or bump. Now, its deficiency is this. Obviously, if you're have a cellular energy, you won't get a signal, because this is an anti-malignant antibody. If you can't make an antibody, it's not seeing the malignant. Now, the malignant is just a dipeptide that they characterized last year at Harvard. Now that we've characterized it, it means we can make it. So if I can make it, I can do some interesting things. One, we can come up with a test to measure malignant itself. Now I have a two-edged sword. If you walk into my office and you've got a tumor, visible, it's already been operated, you just had your breast office. If your AMAS is entirely negative, it means your body wasn't even seeing the tumor. So that means you're going to be dead in a year with about 99% accuracy, unless you're a genius doctor that knows how to bring the entire immune system back. Now, if it turns out that this is somebody who's not already sick and you want another control on it, if you measure malignant, then you're going to know how much of this dipeptide is leaking out of unstable cancer cells. So that's another side of the coin. The director of this, Dr. Bogosh, MD, PhD from Harvard, feels that within about 2 years he'll have a kit and be able to put it in your office, and you'll be able to do both tests on your patients. And we'll be in the new age then of molecular cardiology and molecular oncology. So it'll be kind of fun. Because the fun thing is that I found that I was always able to take elevated AMAS with natural compounds and bring it back to normal, but obviously I was cheating. I individualized therapy. In other words, I used the simple EAB technique so that one patient was enzymes and somebody else is carnivore and somebody else is going to be, I love the vaccines, and I was with Dr. Kindness this week when we can get the tumor, a piece of the tumor, run through Dr. Kindness's lab. Stage 4 cancers are responding dramatically. And so the thing is, obviously, if you can't get that, you can use BCG. It's gotten approved, we believe, in the last couple of weeks. I've used tons of BCG and staph phase lysate. I have always used on my patients, and then we also used what we call it autogenous. And there's many ways of doing vaccines, but it's only a piece of the puzzle. The early elevations of AMAS respond dramatically, and they will see the signal go back to nothing. 135 is the cutoff, and as we get older, I mean, kids are around 60. As you get older, it sneaks on up. On my own body, it kept sneaking up, and I was kind of busy, and I ignored it. And so then finally one year, it jumped from 120, which was upsetting enough because 135 is the cutoff. It went to 165, so I had to stop and look and say, okay, you got me, where's my problem? Skin cancer on the back, took off the lesions immediately, right back to 60, meaning that it had been really pushing my case all those years. And so there's skin cancer in my family. My mother had at least 50 or 60 of them removed, but we were able to, we lived next door to the doctor at the University of Wisconsin that developed the technique for taking them off, very 100% cure rates, but just local, but it didn't change anything. When I gave her the enzymes and the Laetrile orally, she stopped having the skin cancers. Doesn't work for everybody. I don't like it generally, but for prostate. But the cancer profiles are going to be useful. Let me just get down to the end because it won't, otherwise. Anyhow, what we want to make sure then is we get the idea out that, for example, in bladder cancer, it's really important to do the research. And if you can't do the research, you ought to use somebody that will. I have sent people to the health resource for years, and I'm at this point, I have a colleague trained at Sloan Kettering who's into all this kind of medicine. It's offering to become a research person. There's plenty of research. The point is this. Somebody calls you and they say they have any kind of cancer. You can't keep up with everything that's new, and you don't want to give anybody bad advice, especially if you are licensed and we're going to take away your license. And I sit on the board of homeopathic medical examiners in the state of Arizona, and I feel the obligation to protect the public. And if a doctor is claiming he's curing 100% of cancer, he better show me those kind of records, or I have to protect the public and say, no, you're not doing that. And so we now know what it's like to have gone full circle. I'm a refugee from California, having had to flee the state after having sued the medical board and the medical society at great personal risk and cost over the years. But it's really nice to now be on a board of integrative and holistic medicine in Arizona, where only MDs and DOs are licensed under us. But we do know that you've got to know what you're talking about. And if you tell somebody, oh, there's never a time that the chemo works, well, then you're wrong. Because there are times that was the right thing. Even EAV testing will tell you on the patients. Usually it's only 2 or 3 treatments, but it's important to not deny the body what is best for it just because of your own prejudices and opinions. And in this megadose thing in the Vita, the Journal of Urology clearly showed that if the patients got megadoses of vitamin A, B6, C, and E plus zinc and the BCG vaccine, that they didn't have the recurrences because there's a genetic defect in this stuff. Now, talking about genetic defect, I had a child that was 18 months of age and was admitted to the Children's Hospital in St. Louis. Child was blue, pulse rate was 180 to 200, and the heart filled the entire lung cavity. And it was a child of a vice president of a company that I was consulting for. And I knew him, and I stuck my neck out, even though I'm licensed in Arizona. I said, well, I'm going to look into this. So I called the hospital and said, have you done a carnitine measurement? No, we haven't done carnitine. Have you done coenzyme Q? No, we haven't done that. Have you done magnesium? No, we haven't done that. What is your proposed treatment? We're going to do a heart transplant. So I told the family over my dead body. And then the second thing, I was in radiology, so I said, did you ever have an x-ray of that heart of that child ever before? Oh yeah, he had a bad cold 6 months ago. Get that x-ray. I'm on the phone in California, leaving for Japan or Germany the next day, and I get that family to take that and call me from the phone right down from the radiology office so that when they walk into the x-ray office, I introduce myself as a consultant to the family, and I say to the radiologist, tell me about those 2 x-rays. He says, virtually no change, doctor. And they're going to give this child a heart transplant, claiming to the family that it's an acute condition, when that heart was enlarged significantly 6 months ago, proving it's a chronic condition, which then puts the ball back in my court to treat it for the genetic defect. So I had a private healing religious ceremony the family held in the intensive care at the pediatric hospital, where they closed the door and told the nurse no one is allowed. And there, sublingually, we gave all the magic. And in 4 hours, the pulse rate was down to 140 and the blue color was gone. We've since had a medical geneticist see the child and fully agree that this child does need extraordinary amounts of various things. Now, because I wasn't there, I obviously used garlic, because in case you didn't know it, Chinese medical journal shows that terminal meningitis will keep alive if you do garlic IV. So when you're thinking of infection, think about the article that I've handed you, because that one that says on that thing, forget transfer factor, I have not virtually used antibiotics in over 10 years in my practice because of garlic, high dose A, and high dose vitamin C. That is a trick then that obviously we didn't see some of the results that we're now seeing when we were using the corn derived, because all the corn today is all genetically derived. So we are cheating, and we're finding in Germany from a major company, the beet, and the reference, since I don't sell that, you'd have to go to canceroption.com or call my office, we'll tell you where to get it. But I want you to know, we have put out a vitamin C orally, which is not beet. I would love to get beet, there's not enough quantity. But I've done it fully reacted so that it works a lot like the Emergency that I love that they have for you, and the Ester C. But I'm looking at ways that you can deal with infection in your patients. And so if you want to pull 3,000 articles, transfer factor is a real topic. It is clear that I can give a cow an injection of infectious rhinotracheatis, and that will confer to the human resistance to cytomegalic, and it's documented in the literature. So that when you get into this kind of medicine, there's tremendous amount to learn. But we, even though I only run Gordon Research Institute and I don't sell any products to try to keep some freedom of speech, it's still very complex because there are many problems out there. Transfer factor story from colostrum is such a big story that Japan, it's riddled, I mean China, not it's riddled with hepatitis, would love for the Americans who know how to do this to sell them a biologically active material, but that immediately made it a drug. Right now, if we're very careful and don't say too much and you just become very smart, it's sold under the Department of Agriculture as a food. But you do understand that this is a complex area that we're dealing with. But it's interesting to know that on PBS, they had Arthur Schwartz from Harvard do a special, and it had people like David Kessler and Nancy Kasselbaum, and everybody was on this program and said, we have got to stop the abuse of antibiotics in this country, because otherwise we're going to lose half of the population by a antibiotic-resistant infection. So I encourage you to be very clear on trying to learn more about what the shiitake and the reishi and the mushrooms are, because it's exciting and it's another whole dimension. Because just to go back to the aloe story, the aloe that I was lucky enough to find really has the whole high molecular weight, and it takes a spectrum of molecular weights if you want to get all of the binding sites that are on the macrophage and the monocyte to get that tremendous activation, which already this morning Dr. Thomason showed us he's getting with laser. We're talking about the same kinds of things with the tricks. In fact, at the meeting I was just at this week, with the drips of 75 grams of beet-derived vitamin C and the use of other natural products, there was the 400% increase in natural killer cell that you've all become to expect us to do in the natural product industry, whereas drugs usually give you less than a 50% increase, and approximately a 10,000-fold increase in tumor necrosis factor alpha. So we're talking about really inducing apoptosis and really knocking off cancer cells and infections. But you need to understand that obviously these tricks that we're talking about, for example, Stu Wegg on our Board of Oxidative Medicine was in Israel. They showed him all the boys with the mortars that have blown off the bottom legs in the deep-seated infections, and so he did what I'm saying to you. He combined the peroxide and he combined the ozone with the ultraviolet blood irradiation. Now he saw in 2 days such dramatic results that they've invited him to come back, and it will come back to America finally, because once we do it in Israel, it becomes very scientific. So somehow or another these things may come back to our country. But it's very important for you to know that the infections are, for example, the person presenting that work that I'm describing is Dr. Darrell C. And as I said, he's at the Huntington Beach Hospital with 10,000 square feet doing these things. He was the one involved in the ALS research and showed the virus that is in ALS. He's having such dramatic results on some, not the terminal ones where there's only 20% respiratory. Don't get the message out to people that ALS because you can only help the early ones. But they're having people get out of wheelchair and get up and walk, and exciting results. But that was using an antiviral with all of these other things. His whole protocol you'll probably be able to get off of canceroption.com. Will be an easy way to run down Dr. C, S-E-E, who has been deeply involved in the past with Manitech and has done a lot of research with the aloe vera. Aloe vera, again, in one plant, if I spent so much time on garlic when I was all over Japan, and I personally had my picture taken with each of the 1,200 Japanese pharmacists who sell garlic. Anyhow, turns out in one simple compound, you've got chelation, you've got antiviral, you've got antibacterial, you've got the ability to lower the level of organic toxins in the body, and provably such a powerful anticoagulant that it's in Lancet New England Journal because it wrecked their coagulation experiments because they hadn't controlled for the amount of garlic that you might eat when you went out for Chinese food. And so it's kind of interesting to know that these natural compounds are around and you can deal with the complex interplay that I'm suggesting to you, because the infection that we're all talking about is really involved, in this case, in raising a level of the coagulation. And that's the important message, is that when that infection, and when in the model that they're using in the textbook, they show you that in the animal model that they're working on for vulnerable plaque, they can trace back to the plaque that produces the clot that kills, and there'll be as much as a 4 degrees centigrade increase in heat in that local area. So this is a really interesting thing, because as you heard today, every autoimmune disease has some infection be involved in it. Now, Dr. Klinghardt made a great talk 2 weeks ago, and he tied the whole story starting at the beginning with the heavy metals. And that was an easy and a good model to look at, because as I've indicated to you, there isn't anybody on the left or the right of you that has ideal levels of heavy metals, and it's not achievable. That's the bad news. I, as an expert at IV chelation, can tell you that if I give you 10, 20, 30, 40 IVs, and you finally have no more lead coming out, and I say, oh, I'm pretty smart, and you pat me on the back, you tell me how much better you feel, all I've gotten was the superficially available vascularized bone, and then by passive diffusion, all the deep bones within the next 6 months reach a new homeostasis, because I mentioned, folks, 1,000 times more lead, and it was our lab, Mineral Lab, that I was medical director of, and we had offices in Europe as well as Asia. It was our lab that produced the data on IQ of children that proved that every lowering of lead is associated with higher IQ, and it was that data that caused the chairman of Exxon to say, I may be the chairman of Exxon, but I'm also the father of 5 kids, and I'm taking the lead out. I don't care what the other companies did, and when he did, the others had to follow. That's how we got to lead-free gas. So anyhow, you need to know that this is a really important aspect. The heavy metal story is real, but what I'm suggesting to you is, you heard it rapidly, Dr. Garth threw it out for a second. My friend Dr. Dawes, who treats cancer exclusively in Bad Aibling right outside of Munich, and has 18 doctors working for him in a 180-bed hospital where he's doing a lot of what we would call magic in this country, routinely puts every patient on 1,500 micrograms of selenium. Now, if you happen to meet Dr. Schrauser, who's the former president of the International Association of Bioinorganic Chemists, that means he's a chelation chemist, then you would learn that when we put in aggressive levels of selenium and we test you once a week on your serum, many people don't show your selenium level going up at all for 1, 2, 4, 6, 8 weeks. Where is it going, everybody? Where did it go? Every single selenium atom loves every single mercury atom so much that when they find each other, they are mated for life and they're biologically unavailable. So you need to know that there's a lot of stories involved in other ways. And some people might feel, well, that's really bad news for the patient because now you've left the mercury in the body. Well, this is a patient who's going to be dead in 4 months with his cancer. And I am more than slightly concerned about the problem that Boyd Haley has got people really thinking that you can't have your EDTA, even if you're going blind with macular degeneration, where I've never lost anybody's vision if I was able to treat them. But the patient said, oh, I couldn't come to you because I was told that if I couldn't get the fillings out of my mouth first, that I couldn't come to you or even call you, and so the patient's blind now, 100%. That makes it a lot harder to help. So I don't want people confused. We've treated 1 million people, and we do know that whatever you think you know about chelating agents, remember, I start out by saying we have 60 boxes of information. We prove that cirrhosis of the liver, when you're to the point that you have portal hypertension with esophageal varices that are so big you're going to bleed to death, EDTA reverses that problem. We've proven that we treat psoriasis. We've proven that we treat acute juvenile rheumatoid arthritis. We've proven that we treat asthmatics. We have proven so much, but none of that information has been available to anybody because of the complex way the law works. When Abbott Laboratory made a decision to not continue to champion the intravenous use of EDTA by law, they were required to lock their file cabinets. And they had all those studies going on with professors of dermatology, professors of hepatology. All of this research was locked in the file cabinet. It's been my life's work to help try to pry open those file cabinets. And so that's why this whole subject then that I'm suggesting to you here is that by rethinking the model, and the model I'm proposing to you is a model of longevity, anti-aging medicine. And I'm suggesting in that model, you will look at everything a lot more comprehensively and your patient will buy into it. And it keeps us outside of this problem of third-party reimbursement. I happen to be an advocate since I've lived for over 30 years without billing insurance companies, because 30 years ago the computers identified me as a deviant physician, thank you. I'm proud to be one. And the computer simply tracks and says that I'm not doing usual, customary, reasonable medicine. Now, obviously, I love it when I can have a patient have thousands of dollars worth of tests. I mean, it's perfect for me, the patients that come in that have been rejects at Mayo Clinic, because A, they're frightened to death, B, they have tons of studies, C, they've been told that tons of things are wrong with them, and next, they have no real approach to dealing with it. And it protects me legally because I don't have to think about all those possible problems, and I can really waltz around the fun of dealing with traditional Chinese medicine and learning what huperzine and osteovone. If you don't know about osteovone, it's real, and it really helps on bone density. And there's huperzine will beat Tacrin hands down when you get into Alzheimer's. There's no shortage of answers out there. I go every year to the lectures that are put on by the whole food industry, and it's shocking. I have to tell you, there's 25,000 attendees. There's over 2,000 booths. The people who are speaking are the professors from virtually every country in the world who are doing the basic research on all these natural products. And guess who the audience is? The people who work in the GNC and the other health food stores. And none of you get a chance to see any of this. And I sit there and it just totally devastates me to realize how solid the science is, but how difficult it is because they have walked into the easy open market. They're in the health food stores, all of which are practicing medicine. And I'm kind of proud that it was my legislation in the state of California that made that possible. I was the one that helped write and carry the legislation that exempted the giving of nutritional advice from the Medical Practice Act, because about 20 years ago they arrested the lady down the street from my office in Sacramento because she told somebody with a flu to take vitamin C, and they put her in jail. And my patient at that time was the head of the Republican Senate and the head of the Democratic Senate, so they co-sponsored the bill. And even though the AMA and the American Dietetic Association and everybody was there to kill the bill, I had treated these people and their fellow senators, and they said, we know you all have a vested interest. We've seen what Dr. Gordon has done, and we're changing this law. Because at that time, it was very simple. You look at somebody, you say, sit down, you look tired. You've made a diagnosis and offered treatment. You're practicing medicine, so don't look at anybody and say, sit down, you look tired. So the thing is, unfortunately, as I said, what we are practicing really, folks, to be really honest, if you go to the language on the website under Institutional Review Board, we are not practicing usual, reasonable, customary medicine. That's pretty clear. So if you're not UCR, what are you? You're investigational or possibly research. If you think you're research, there's a gun pointed right at your head that says you better put yourself under an IRB, because that's why they took Dr. Sanako's license in the state of California for doing the same enzyme potentiated desensitization all the other doctors have been safely allowed to go ahead and do, because they all agreed to collect information on every patient rather than just coming as we love to do. All of us love to tell about our success stories. It's very, very important to learn from our failures. The patients we don't help are the ones we will learn the most from. And so when you become an IRB, and I sit on the GLACAM, the Great Lakes Academy of Clinical Medicine, IRB, and we are in charge of the study on the treatment of cancer with the vaccine and many studies like that. in the Heil study on DMPS, et cetera. And I have, the thing is that if we can get people to say, oh God, I'm already so busy, how could I do one more thing? Well, obviously, we're going to be in the age of interactive computers. And very soon, we're going to be able to give you a thing that the patient, when they come in, tests and say, yes, I'm still taking the pills, yes, I'm better, no, I'm no better, and we'll have the data instantly. And it won't be driving you crazy, but meanwhile, you become a real researcher. Now, what does that mean? What's the advantage? Well, the advantage is that I sit on a medical board, and I have to cover all the other doctors who are licensed under me. I can't take a chance on some wild guy coming in and say, horse dung cures baldness, even if he's right. It sure doesn't make me look good if one of the patients dies. Now, who can die? I had one of our really bright licensees give an injection in his little operation. He's a wonderful guy, trained at Yale. 18 hours later, the patient's dead. Now, that can happen to any one of you, and I want to make this very clear because I have had to become an expert because we are a small board, and I can't afford to lose all of our doctors' licenses in 1 year. So I've had to really study this issue. And it turns out Clostridium is about 1 in 100,000 people will die of Clostridium. Now, you assume when I say that he must have been careless, and he must have let that injection, when he drew that B complex, or they die with B complex, they die with flu shots. They're not fussy. They'll die with anything. But you assume that it was in the injection. It wasn't. Only 98% of us test positive for Clostridium in our GI tract at any given time. There's another infection. Now, what would you think the incidence is if I culture you on this part of your anatomy for Clostridium? What percent do you think? 5, 10, 15? About 35% of all people test positive right here. Now, but you're going to take care of that because you're a real doctor, so you're going to rub it with the alcohol sponge. And now it's 60% test positive because you've debrided the outer layer and you've made it easier for the Clostridium to grow. So little things that you never knew and you didn't want to know. But therefore, what is the point? Why would I bring all this up? We've had a wonderful day. We've learned some wonderful things. I'm trying to make it clear to you that I have been in the courtroom for 28 years and I've spent a lot of time fighting with the FDA and the Federal Trade Commission, and we've come out of those things bruised. ACAM didn't win on the issue that they claim that they're going to replace coronary bypass disease, and they will not win on that issue because the standard is too high. When there's 100 billion on the other side, you're going to have really gigantic studies where everybody goes from dirty arteries to completely clean in every case with no exception, or we're not going to win that war. So I'm just telling you, I love chelation. It changed my life. On the 8th treatment, I could run up a hill. I wore my Irish setter out. I'd never been an athlete, and I turned out like somebody taking me from 110 to 220, and I've never shut up since. But chelation was for me a miracle. But the problem is, I'm now in this complex thing that we have to communicate accurately. So I told you I give a tape to my patient. Since I've done that, I've never been sued. It's been very useful. Because you learn how to express exactly what you think you're going to do for the patient, for how much money and why they may want to do it or not do it. Because remember, if they do die, and as I said, maybe it's only 1 out of 100,000, but somebody's going to be dead someday. You better have a clear understanding. What was the benefit-risk ratio of what you proposed to do? And if you've got that down in clear things, then it's pretty good. But you should see the charts that I get given to defend. Chief complaint acne. The girl's 18 years of age and she's dead. And Dr. Gordon, will you please defend me? Sure, wonderful. It's not a very good record for me to fly from. And so what I'm suggesting is that Medicare this year has been really turned into a Gestapo. President Clinton signed a bill for $41 million worth of new former police agents to come into your offices and go through your records on any billing that you do to look for what we call medical fraud. And who could do medical fraud? Well, it was in Time magazine 3 weeks ago that the top fertility specialist in the United States, who's treated some of the most powerful people in the United States, is going to jail, folks, for 10 years and will be about 5 million more broke. I have many doctor friends that when they get the bill, for the little mistake they make, it's between 10 and 16 million. And guess who gets to have a part of that? Your office staff if they turn you in, or the patient if they turn you in. But the cop that comes in to go through your records also gets a portion to keep his agency alive. So he obviously wants to really let you off easy and say, oh, doc, we know it was just a little oversight. The patient called you that day and you ordered an EKG and you didn't happen to make an entry and you spent our money and we had to do the EKG and pay for it with Blue Cross money. And there's no entry in the chart saying why we should spend that money. So we're only going to charge you $10,000 for that violation. Let's see what the next chart looks like, doctor. it's pretty good if you have a reason for everything you do. Now, as a researcher, it is absolutely illegal for me to let Medicare pay for any test, because that's clearly going to feather my nest, because if it proves that my oral chelation is fantastic, I'll obviously sell more of it. And does Medicare want to help me prove anything? No. It's not their problem. So that's where I need the doctor across the hall. But I just feel sorry for him if he's not smart enough to know that if he doesn't keep good records. So I can send the patients to every doctor in town. But please, docs, keep good records so that all of them, I don't want to bankrupt all my colleagues by sending them patients, asking them to say, hey, this guy's got chest pain, would you please do a PET scan or ultra-high-speed CAT scan? These are complex issues. Ultra-high-speed CAT scan gets better on some people, even on oral chelation. And on IV, we have some patients worse, and it's why. It's because when you hit the nail on the head, when you give the exact treatment that was right for the patient, those are the dramatic stories we come and enthrall each other with. We have to learn from the ones that we didn't help, who went home and died. Because those are the patients that keep us very humble and keep us in the position that we will refer cases to our doctor colleagues, because none of us can do it. I tried to be a one-man band. I wound up with over 40 employees, 17,000 square feet in Sacramento. I had a fixed overhead of $10,000 a day. I tried to be a one-man band, and I learned a lot. All of this stuff really does stack, but it wasn't good for my health, because my total take-home salary averaged $1,000 a month for the last 2 years of my practice, because I was learning, but it was not possible to do that cost effectively on a cash market basis, because I was still treating disease. And I was treating lots of cancer, lots of vascular disease, lots of multiple sclerosis. But it's important for all of you to understand that if you don't have all the answers, be the really good guy in town who knows who the other people are in town that are good. That protected me tremendously, since Blue Cross and Medicare said, we're not going to pay. I had a $52,000 algothermograph. I'm an expert in thermography. I had treadmill cardiology. I had dark field. There wasn't any toy I didn't have, because I needed it, because my clientele was international. They came from around the world, and I needed answers. And I particularly needed to protect myself from a medical board who was very concerned. And I didn't at that time share their concern. Now that I'm on a medical board, I can feel a little bit more what it's like. When that body was dead, I didn't know when I went to the board meeting that morning, was it going to be surrounded by the media? Were all the press reporters going to be there? Okay, why didn't you stop this, doctor? How come this patient's dead? You know, that's how you have a little, it gives you a little different feeling when you actually sit on a board and have to protect the integrity of the kind of medicine that all of us love in this room. And so this is a couple of issues that are not going to be cheap for us to solve. I mean, one doctor can write a multi-center IRB, but most people hate to have to write anything. It's worse than doing a PhD thesis. You have to sit down and do it. I mean, even if we're all your friends, you're still nervous to come in front of our board, and all of us are alternative doctors. And all we want to do is have you give us a good informed consent so the patient is protected. He knows what he's buying into. And we want you to give us some kind of endpoint as to what are you going to measure. A simple outcomes analysis. You can do a short form 36 questions that are approved by the Medical Trust of Boston. And those questions are so not leading. You know, in court they always try to have a leading question. You really murdered the person, didn't you? You know, these are non-leading, to find out from the patient, is he really being helped by you? And if you do that 6 months out and a year out, and you hire a person after high school to contact those people and fill that thing out, now you're a researcher. And the big secret is then you're allowed to advertise legally for patients that you may feel really qualified to see, which means that you're not wasting your skill treating things that are really out of your area. If you're interested in autism, or you're really interested in chronic fatigue, or you're really interested in cancer, it's really neat if we kind of get the right patients to you and they know they're a research subject, so that if you tell them, I really want you to have this ultra-high speed, the ultra-sensitive C-reactive protein that Dr. Gordon pushes in the fibrinogen, and you can trick your other doctor into doing it because you come in as an informed patient. And that's what the web is doing to all this. The web is changing the way medicine's practiced, because the average doctor today, at least in an average day, is going to see 4 patients where he's ready to say, there's no other treatment for you, Mrs. Smith. And the Mrs. Smith, my 14-year-old son last night was on the internet. What do you think? What do you think of this, doctor? And so that is the kind of world we've come into, and it is information overload for all of us. I'm lucky enough that I'm really not an expert at any of the fields that I go to, but I go to the medical meetings of everything from holistic medicine to environmental medicine to nutritional medicine to acupuncture medicine to worldwide. I'm at Seoul one day, and I'm over in Tokyo in a couple of weeks on alternative cancer, and I'm at Baden-Baden with just to be with colleagues at Baden-Baden, 4 floors of toys that I'd never seen before. I was in like hog heaven. I had to go back 3 years just to cover those 4 floors of exhibits of stuff that you've never seen. The lectures are all in German. I don't speak German, but I'll walk into the lectures just to see the before and after slides. It's incredible to see what's going on. And there actually is an oncology book, How to Treat Cancer, with BCG and mistletoe and all the rest of that, and it is available in Germany, and that has been this complementary oncology by Dr. Hager. This book, if you happen to read German, unfortunately I would just haven't been the bucks to get it translated. But to realize that in Germany we have biological hospitals that do nothing but treat cancer, and it's all legal, and the insurance pays for it. And that is a real different world. And I've been on those wards seeing patient after patient, some who looked as healthy as some of us in the audience, who were there with malignant melanoma where we hadn't found the primary, but it was already metastasized to the brain. And malignant melanoma happens to be very responsive to things like BCG and other things. But it's just astonishing when you go to that level of learning what's out there, because there is a tremendous amount of things that are out there. And it is very hard for any of us to retain all the information from the meetings you go to and to get that into the patient's hands at the right time, which is why I started out by saying let's empower the patient by using search companies. And I said that, yes, I'm sorry. Go ahead.
What you just said about Germany, though, makes me think very strongly. One of the biggest hurdles that we as practitioners of complementary medicine have is overcoming the brainwashing of the people.
Of course, what you're saying is that our patients obviously are resistant to good digging in their pocket and coming up with cash to pay for the knowledge that we have. No.
They've been so brainwashed by television and the standard medical
Right.
One of the first things I tell a new patient is, one of the things we have to do is undo all this brainwashing. That cholesterol is the cause of all of your
That's clear.
problems.
Well, obviously, this is a very education, information intensive thing. Websites are going to be very beneficial in this area. You need to understand that when I can now tell anybody, go to gordonresearch.com, and if you go to my website, you're going to be able to download the kind of information that we've been talking about here today, and that way you don't have to carry it with you. Because if you bring it, like I want you all to pick up at the back of the room, and I want you all to get the tape that we have back there, but you'll lose it because we're all overloaded by the time we get out of here, and you're swamped with patients when you get back. But what you do on the websites is always there. And if I had all of your email addresses, which we as an association need to get, because now at least 75% of us in this room have an email address. That takes me 1 second to keep you on my weekly alternative newsletter. And now all of a sudden, you are getting all this information because I look at this from many viewpoints. A, what works, that's fun. B, what's going to help our patients. C, how can we do it and still keep our licenses and not be guilty of problems that we didn't even know that we were guilty of. And so I would, yes, we can give it.
We don't have all red charts to go out for everybody, Gary.
Oh. Okay, I'm sorry. The audience turned out to be, I think I brought 100, but in any event, anybody who didn't get this, just hand me your card and it will be mailed along with a free tape. I apologize that I didn't have enough for the whole audience. Thank you very much. You've been a fantastic audience.
Quick question. Anybody any questions? Quick. Otherwise, wine, please, party starts as soon as you get to room 350. Be there or be square.
Yep. Thank you. No, I bet you didn't have any cards. Got it. Thank you. Thank you.